Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
This is KRWG Public Media, TV, radio, online, news that matters. Now, across the Mesilla Valley and the borderland, the stories that shape our community. From the KRWG Broadcast Center at New Mexico State University, this is Newsmakers.
Welcome to Newsmakers. I'm Anthony Moreno. On the program, we focus on mental health issues facing our region. Here to share more on these challenges is Sherry Roden, Executive Director of NAMI of Southern New Mexico. Sherry, thanks for taking the time to talk with us.
Thank you for having us.
Can you share a little bit about the mission of NAMI of Southern New Mexico?
At NAMI Southern New Mexico, we are an organization that was founded in 1979 by two mothers around a kitchen table. And today we're the largest grassroots organization in the nation. We have over 700 affiliates and 48 state affiliates. We are one of 4 here in New Mexico.
What are some of the major challenges that your organization is dealing with right now?
We work a lot with the houseless population, and there's just a lot of wait lists and stuff for resources, and we often have a high turnover with our providers, so it's often hard to build rapport. Once you do receive services, you're often shuffled off to another provider. And a lot of the basic needs aren't being met, and because of that, they're not taking care of their mental health either.
How challenging is it to work with folks who may not have a home in our region? Is it challenging to get in touch with them, or to communicate and keep them updated and informed on what's happening?
It is. Often we'll help them get like phones and stuff that they have access to, but when they're staying on the street, it's lost or stolen, or sometimes even traded for meeting their basic needs.
How key is it to partner up with other community groups or a local government to ensure your mission?
It's very important. All of the services that we offer at NAMI Southern New Mexico are free to the participants. We cover our services through a contract with Doña County and other grants and stuff to keep us going.
The county recently saw the closure of the Crisis Triage Center. Can you share a little bit about how that impacted your mission?
It's definitely made things a little more complicated. Some of the other partners that we work with are experiencing difficulties with where to refer people in the first place. Our detention center, for example, averaged about 200 referrals to the Crisis Triage Center every month. Not that all of them would go, but now they don't have somewhere like that to send them to first when they discover they need the services.
How essential do you think that center is to behavioral health services in our region?
It's definitely very valuable. The fact that they can go there and get a reprieve, sometimes for the houseless people, it includes being able to get a meal and get a shower and just feel human again so they can go back at dealing with the circumstances that they're living with.
In some of the discussions you're having with officials, how do you think they are responding to the needs that you're bringing forward to them?
I definitely think that the director of Health and Human Services has been really receptive in finding solutions.
At the county level, you mean?
Yes, at the county level. I do know that they are working on a potential contract to reopen the CTC. So hopefully that will be able to happen soon.
What are some things that you hope are implemented when the center is reopened so it may be sustainable?
I think one of the biggest difficulties that the Crisis Triage Center has is its location. With it being right next to the detention center in the same parking lot and everything, a lot of the clients that we work with are really resistant to going there in the first place. It's a locked facility, and a lot of them experience the trauma from being locked up for one reason or another, and just going right there makes it very difficult. The staff that we've worked with from there have always been great to work with and very helpful in finding resources. But I think the location is one of its biggest barriers.
I see. Your organization does a lot of peer support work. Can you share a little bit about that?
Yes, we have peer navigators. We have all 3 levels. We have youth, adult, and family peer. And all the individuals providing the peer services have the lived experience and can help to navigate our very complex systems. With the family, it might be a school issue, maybe a student needs an IEP or an individual treatment plan, education plan. Or maybe it's the juvenile justice system for family. And we also work very closely with the court systems, and we can help understand diagnoses and find resources for the basic needs that, like I said, are often barriers to recovery.
Once you get outside of Las Cruces, it's very rural in our region. What are some of the major challenges facing rural communities when it comes to getting access to mental health care?
Some of the outlying communities that we serve outside of Las Cruces, some of the barriers we experience are, even though telehealth is possible now, they may not have access to the internet. Some people don't even have access to a device that could hook them up to the internet. And in the smaller communities, the resources are even more scarce than they are here. I mean, this is a fairly populated area here in Las Cruces, and we still struggle to keep up with the need. And in rural communities, Deming, for example, there's providers that don't even have therapists on staff right now because they're short-staffed, and that's really not uncommon. Sometimes when bigger organizations come into small communities, they create barriers by requiring them to go like from Deming to Anthony to do an intake, and transportation's often an issue, or getting time off of work. It's just very difficult. Living in Deming, me and my family had to receive a lot of our services right here in Las Cruces. So anytime I would take my kids to therapy or anything that we were seeking, we would end up coming here instead of doing it in our community. It has built up some in the 10 years that I've lived here, but not near enough to keep up with the demand that we have. Since the pandemic, our numbers pre-pandemic were 1 in 5 in mental health. And I'm not exactly sure if our state has lowered it yet, but Johns Hopkins has lowered us to 1 in 4 individuals experience difficulties with mental health. So we're seeing a change in times where more mental health is coming forward, or maybe it's less stigma and people are more willing to talk about it. But it's definitely more need than it was before.
There's certainly been a lot of concern about resources being available, being able to recruit and retain providers in the area. What do you share with state lawmakers who may be able to make a difference when it comes to providing resources and funding and infrastructure in New Mexico? What are some of the things you share with them?
I really think they've taken more interest in increasing peer services and peer support workers, but I really think they need to focus on increasing the jobs for those individuals that are completing those certifications. You get done with your certification, and many of them will let their certification expire because they were unsuccessful in finding work in the field. Peer services has proven to be cost effective. It decreases the amount of money that the system puts out for each individual, and often the treatment's more successful because they get the camaraderie of a person that's experienced it, and they're able to help explain it in better ways.
I just have under a minute left with you, but I'd like to hear from you. You mentioned the stigma may have been changing around conversations with mental health. Where do you see improvements?
Our youth have been real champions for mental health. My daughter, for example, she's very vocal about it, and she's not afraid to talk about the fact that she deals with mental health issues. And when I was growing up, when I was her age, it was very hush-hush. We didn't talk about it. But the youth are definitely a lot more open to it than previous generations ever were.
I see. Sherry Roten is Executive Director of NAMI of Southern New Mexico. Sherry, thank you for joining us.
Thank you.
We'll be right back. Since the closure of the Crisis Triage Center in Doña Ana County, officials, healthcare providers, and advocates have been working to help fill the void and help those in need access care. KRWG's Johnny Coker reports.
Earlier this year, the Doña Ana County Crisis Triage Center closed its door to patients. The facility's behavioral health provider, RI International, ceased operations after the company was denied grant money by the Board of Doña Ana County Commissioners. County officials have cited multiple factors that led to the closure of the Crisis Triage Center. Doña Ana County Commissioner Shannon Reynolds cited cost as well as the want to bring in an in-state provider to run the center. But as it stands, the Crisis Triage Center is sitting vacant, waiting for the next provider to fill the shoes left by the Arizona-based RI International. Javier Cornejo is a peer support worker who formerly worked at the CTC and said surrounding communities are in dire need of behavioral health services.
People in positions of power need to understand that right now we are going through a fentanyl crisis. We are going through a mental health crisis after the pandemic. Anxiety, fears in people just rose.
Supporters of the Triage Center say crisis centers can help ease the burden on traditional healthcare facilities. According to the latest data from the New Mexico Department of Health, mental health emergencies accounted for 6.5% of emergency department visits in the state between July and September of last year. Jess Spohn is the former clinical director for the CTC. Spohn said there is a demand for crisis care in southern New Mexico.
Our healthcare system is not very easy to navigate, right? So if you need a therapist, or you need med management, or you need, peer support, or, case management, any of those kinds of things, it can be difficult to try to get it on your own. And so the CTC was a kind of a one-stop shop that we could help connect people to whatever that next step is, help them de-escalate that crisis, right? Help them feel better.
Spohn said that operating a 24/7 behavioral health facility isn't cheap, but the services that the CTC provides are valuable to the public. The Doña Ana County Crisis Triage Center has been empty since the end of January, but officials are working to change that. Jamie Michael, director of the Department of Health and Human Services of Doña Ana County, said that she's in the process of finding a new provider for the CTC.
We've got a company that's capable and viable, and so how do we begin these conversations and get a contract in place? Take what was working in the past and learn from some of the challenges. So when it does reopen, we kind of have the best of both worlds.
Michael said that under RI International, the CTC had to take in at least 6 patients per day to break even financially, and said that legislation passed last year, which allows people to come to the center both voluntarily and involuntarily, will help cover the costs of the Crisis Triage Center. Additionally, Michael said that it's important for the county to make the center more visible to the public.
Crisis care and crisis triage centers are still very new. So we need to do a better job of connecting with the public, connecting with providers, families and friends, getting the word out that this facility exists and how it can be used and how it can be part of a behavioral health system.
but providers in the surrounding area are feeling the void in services, according to Tanika Sosa Gonzalez, Director of Community Solutions and Impact at FYI+.
In my partnerships with others in the community that are boots on the ground, they have seen an uptick, and they're very concerned. We relied on the Crisis Triage Center to be our 24-hour mobile crisis partner for adults, and so working to fill that gap has been where the majority of our efforts has been placed.
Sosa Gonzalez said that while the closure of the center has been disheartening, the community response has given her hope for the future of the area's behavioral health landscape. As it stands, it remains unclear how long the Crisis Triage Center will be vacant. With the gap in behavioral health care, surrounding providers are working to get individuals the help they need, and the county is assessing its options in getting the CTC back up and running. But for stakeholders like Sosa Gonzalez, the goal is to continue to address the shortage of mental health resources for Southern New Mexicans and do the best job possible with the community's limited services. For KRWG Public Media, I'm Johnny Coker.
Joining us on Zoom now to share more insight into how the county can address mental health is District 3 Doña Ana County Commissioner Shannon Reynolds. Commissioner Reynolds, thanks for taking the time to talk with us.
Thank you for inviting me, Anthony.
You and two other county commissioners voted against state funding of over $560,000 to go to RA International to help with operations of the Crisis Triage Center. Can you share with us a little bit about why you voted no?
Yes, sir. We actually provided them with a contract to provide services roughly in 2020. And for those services, we expected a certain amount of results. So one of the discussions we had was how many people they needed to see each day in order for them to make a profit. We discussed that as part of our initial contract, and they told us kind of what they expected, and our expectations were that they would see enough people that they would make it profitable without having to ask us for additional funding. So when they came back and asked for additional funding about a year and a half ago, we did approve that. And then when they came back and asked again for the second time, both times I asked and we requested for results. So show us how that the goals you need to achieve, i.e. seeing roughly 6 patients a day on average in order to break even, was actually going to be possible. So what are your plans, we ask them, to actually get from where you are now, roughly 3 patients a day, to 6 patients a day? The additional monies that we approved for them was in order to cover their costs of operation, just at a basic level. But my concern was, look, if we have a plan, we have a contract, and you're supposed to be able to survive on this contract and make some sort of profit, then we shouldn't have to continue to supplement that income with additional income or additional fees.
KRWG reached out to RA International. In an emailed statement, the company's deputy CEO, Paul Galdes, told us that he has never seen county commissioners reject funding from state leadership when it is designed to serve the local community, I'm quoting, without any expectation of financial contribution from the local community. So what are your thoughts on the response from RI International and what's happened and unfolded with the Crisis Triage Center closing? Do you have some concerns about that?
Well, I do have concerns about the Crisis Triage Center closing. And I agree with him that there were funds expected from the local community. As a matter of fact, our initial contract included $260,000 a year, regardless of how many people they saw, for a 16/7 operation, and over $300,000 a year for an operation that was 24/7. So we held up our end of the bargain by providing additional revenue necessary in order to bridge the gap between what they expected to receive in revenue and what we actually gave them. So yes, I do have some concerns about them closing abruptly. I think from the time that we started the service, we did provide a critical, needed service in the community. However, albeit we weren't serving as many patients as needed in order for them to break even or make a profit, but my belief is that should have all been considered in the initial contract. And if you look at my position on the initial contract, I stated that I did not believe it was possible for them to be successful with the contract. because we, as a rural area, implementing their plan was not going to provide a sufficient amount of income for them to be viable. So even from the start, when I voted no, I felt like that it was going to be tough for them to basically be successful. Now, recently though, closing it has been a problem, and closing it so abruptly has actually created now a void in the community that we need to fill. And immediately after I realized that they were going to cancel the contract, so about an hour or so after our meeting, I reached out to a couple of organizations and another couple of commissioners to try to see how we could retain someone else to continue that service.
What are your thoughts on the Crisis Triage Center being able to open up anytime in the near future? And are there some things you think need to be implemented with the Crisis Triage Center with the next operator so that this facility can be sustainable?
Well, first thing, we are trying to get it open as soon as possible. One of the challenges that we have is finding or creating or growing an organization that actually is certified to provide the same services. There's actually a state statute, New Mexico medical requirement that they have to meet in order to provide the kind of services that we require. We don't have an organization locally or an organization we've identified that's currently certified to provide those services. So we're working with a couple of local organizations to try to get them certified as quickly as possible. The process is going to take normally about 3 to 6 months. We've requested, or at least our county has, requested that we get emergency authorization for someone to temporarily take over and provide those services until they can become fully certified, number one. The rest of that question, the second part of the question was?
What needs to be done so that this facility can be sustainable? We just have a couple more minutes with you. So I want to move on and talk about another issue, and that has to do with the burden on law enforcement. Are you concerned that having the triage center closed puts a greater burden on law enforcement in the county?
When you think about it, the law enforcement has a great burden whenever we're dealing with mental health and not doing it in the proper way. The 988 number was actually created at a federal level in order to provide a service that will identify critically ill patients or critically disturbed patients or ones on medication that need special care. We have implemented that at the state level. And if in fact the 988 number is used in order to take action against those, then the law enforcement should not be as impacted by that as they would have been before 988 was installed. Now, does it provide more challenges for law enforcement if they do run into people with mental health conditions that haven't been identified through 988? Yes. However, I don't know that will change whether this is open or not unless 988 is fully used and accessible by the people who need it. So the challenge is still going to be there. If we arrest someone or we can encounter someone with mental health problems and we don't have the proper resources there that are not officers, then we do run the risk of not being able to provide the services necessary to de-escalate the situation. So I don't believe this adds additional challenges to them. It just takes those challenges and moves them to the hospital. Currently, Memorial Medical has the ability to handle them, but it takes a lot longer than what the Crisis Triage Center did. Having
resources for behavioral health services, folks in crisis, are certainly a concern for a lot of folks in our region. Our region has been underserved in a lot of ways. Another issue that folks are concerned about is substance abuse. What are your concerns with substance abuse in the county, and what are some things you think the county commission can do to help address this issue?
Substance abuse is something that we've been dealing with for years. I mean, you're just talking about different substances. I mean, people are probably saying, what about, marijuana? Now that it's legal, do you expect that we're going to have more substance abuse? Of course, we're going to have more availability, so there's going to be more abuse. What can we do? We've actually identified as much as possible ways in order to manage the use of marijuana and legally make it available without creating as much more of a problem for other people. Something that we do need to do, though, is we do need to continue with some of the money we're getting from the substance abuse settlements that we're getting from the drugstores, the drug companies. We need to use that money in order to provide programs to help people to properly manage the substance abuse problems that they have. And we know that we're getting at least several $1 million to actually implement those programs, and those programs are specifically designed in order to try to curtail the problems related to any kind of abuse, substance abuse, whether it be alcohol, drugs, marijuana, whatever, but mostly it's for the people with prescription drugs. Yes, we plan to use that.
You're referring to the opioid settlement funding that is coming into the area, the state, and the county. I want to give you a chance to answer that question, though, when I was talking about the sustainability of the Crisis Triage Center. What are some things that you would like to see happen so that the center can be sustainable?
What I'd like to see happen is I'd like to see just the right kind of staff do it, and we staff it in such a way that we don't overstaff and we don't understaff. Something we did approve that was not taken advantage of is a mobile crisis unit. The county actually provided funding for a mobile crisis unit for RI. They used it for about 3 or 4 months, and they decided that it wasn't needed or they didn't have the staffing to make it successful. I think we need to go back to a model that actually provides a mobile crisis unit and copy some of the stuff that the city's doing. The Las Cruces City Department has actually created a task force that specifically responds to 988 calls or substance abuse type calls, and they've been fairly successful with it. As a matter of fact, most of the patients that were seen at the Crisis Triage Center from the officers for police force actually came from Las Cruces. The county didn't do it because we don't really have a task force like that set up at the county in order to address specifically, substance abuse. So we could actually continue to provide funding for the mobile crisis unit and find an organization that's willing to use that to respond to calls. And I think that would help a lot as well.
Okay, Commissioner, unfortunately, we're out of time with you, but I want to thank you so much for joining us. Doña Ana County Commissioner Shannon Reynolds, thanks again for being a part of the program.
Thank you, Anthony. I appreciate you taking the time to visit with me as well.
Thank you. We thank you for joining us for this week's program. Remember, you can always stay updated on the latest news at krwg.org, where you can view and listen to the latest content from the KRWG team. KRWG is also on social media. You can like us on Facebook, follow us on Instagram, and subscribe to KRWG Public Media on YouTube. For all of us at KRWG, I'm Anthony Moreno. We'll see you next time on Newsmakers.